Again, now the SANDF will be deployed to help fight COVID-19 in the Western Cape. It will provide doctors and nurses and help with law enforcement and infrastructure. Well, Aisha Ismail is in Cape Town. She's there to tell us more. Aisha, a very good morning to you. And yeah, just give us some idea of what the plan is, how the military is going to fit itself into this, and just the cooperation that's actually needed here.
Yes, good morning, Uveka. Firstly, I'm here in Mitchell's Plain at the new Mitchell's Plain Hospital of Hope, and this is actually here at the Lentegeur Hospital, but there are 200 additional beds that have been made available because we've been talking about the Western Cape starting to peak this week, and so health authorities and the Western Cape government, they have been busy setting up, getting more beds, getting more staff, and as you say, even asking for the SANDF for help. And I'm also now joined by the Premier of the Western Cape, Alan Winde, who's just also done a walk around here at the Mitchell's Plain Hospital of Hope to make sure that everything is in place for when we start reaching our peak. Unfortunately, with the peak, there will be more hospitalizations, more infections, and of course more deaths. So, Premier, once again, the focus now is also on getting things ready, and one of the things that the Western Cape government has done through the health authorities was to seek help from the military. What has the answer and response been to that?
So I've just checked now a second ago. We still haven't received the formal document, but we've asked for medical staff to come and help. And according yesterday's Digicon with the HOD, the medical staff, or military medical staff, we really need them to help primarily in the Worcester decanting area. Because that's the area now that we're starting to see the numbers put on pressure. As you said, it feels like we're in our peak now. You only know when you go down the other side. And so, we're at capacity, but we've got to make sure we've got extra beds in place and staffing, because staffing is a big pressure point.
Now, with regards to beds, I know that this particular facility, the beds were donated by the Gift of the Givers.
Okay, so the Gift of the Givers are partners. There's also other NGOs that are involved in this area, so that's really great when NGOs and charity organisations come and help us. And of course, we're so lucky to have this facility as well. We've decanted some of the patients that were involved in this facility to others, so that these can be dedicated. There are 200 beds here, which are ready now. It's taken 8 days to get these all in place, pipe in the oxygen. They've put up big oxygen tanks outside, you might have seen, and that really is so that we're ready. Oxygen is a key component. We don't want to run out of beds, we don't want to run out of oxygen, and we need staff. Also I appeal for volunteers, people who are medically trained and would like to come and offer their services. We also welcome that too.
So, Premier, besides Worcester, where else will the military be deployed?
Okay, so far it is only necessary there, but we're looking for staff wherever we can find staff, because our frontline have been doing this for 9 months now. And of course, if we remember the first wave, the Western Cape was so much ahead of the other parts of the country, so we could contract staff from other provinces. Now we're not able to do that, because other provinces are also needing staff. So that's why we keep on talking about staff, making sure that we have sufficient. We want beds, staff, oxygen, making sure that we can give every single person the care that they need.
Everybody's talking about the vaccine. And at the Digicon yesterday and last week, the head of health, Dr. Keith Kluti, talked about the Western Cape, that the Western Cape government and, of course, with the help of the health authorities, will be doing everything possible to try and get the vaccine to the Western Cape as soon as possible.
So first of all, we need to make sure that we've got logistics, we've got the rollout plan. We normally do vaccinations, but the numbers are much lower than a normal rollout that would be needed now for COVID-19. So that plan is almost finalised now, where you'll get your vaccine, who's involved in it, and obviously the plan also depends on what type of vaccine, because some vaccines need a much lower temperature value chain or system, logistics system. Others would need a different temperature. You could actually then expand that even faster. So that plan is the plan that the department's working on. We know that there's a national government saying we've got a single sourcing and a single plan. And of course that's fine, but as the province, what we are also doing is saying, well, if we've got the rollout ready, is there any other way that we could source vaccines sooner? And of course we also know that they have to be SAPRA approved, but if we can get it sooner than the second quarter, we definitely will. So I personally am also involved in that, making phone calls, trying to make sure that we try to get a vaccine as quickly as possible as part of our overall management of the COVID-19 virus and then, of course, the recovery plan.
Now, besides the hospitals, and these here we can see it's already an existing infrastructure, but in order to cope with the increase in infections, tents have also been set up.
Okay, but the tents are not for putting patients in like this. The tents are to help us with extra space in our hospital, so it'll be triage, people coming into the system, so that we could deal with them separately from the other wards or the other entrances to the hospital, because you still want to come to the hospital perhaps to give birth or for some trauma need or for some medical need. And so we create that separate space. So most of our hospitals now have got that tented facility that we put up in the first wave. We now put them up in the second wave as well.
Thank you so much for your time. Rebecca, that was the Premier of the Western Cape, Alan Winde, who's going to continue with his walkabout here at the Mitchells Plain Hospital of Hope to make sure that this facility will be ready for when we do reach that peak later this week.
All right, Aisha Ismail, thanks so much for that. Well, from the Western